Hello and welcome, beautiful people, to this episode of the Montpelier Happy Hour here on WVEW 107.7 LP Brattleboro, your community radio station. I am your host and producer of the Montpelier Happy Hour, Olga Peters, and I am speaking with regular contributor, Representative Emily Kornheiser, who is one of 3 reps from the town of Brattleboro, as well as Representative Theresa Wood, who is zooming in from Waterbury. Thank you so much for joining us this morning, Theresa.
Oh, I'm really happy to be here, Olga. Thank you.
Well, for folks especially in Windham County, who may not know Theresa, she is the vice chair of the House Committee on Human Services. And in her pre-legislative life, she was also the director of the Developmental Disability Services, as well as Deputy Commissioner of the Department of Disabilities, Aging, and Independent Living. And Tropical Storm Irene, she was very involved in rebuild Waterbury after the storm just sort of went through the town, we'll say. So Theresa, so glad you can be here. Tell us, I'm always fascinated by the Human Services Committee because it seems
like Olga has frozen, and so I'm just going to start talking from here. As I was listening to your bio, Theresa, I was just thinking about how extraordinary it is that, like, in the citizen legislature, we have this mix of folks who are. Olga, you froze. We have this mix of folks who are it's a citizen legislature, but some folks are like very, very qualified for what they're doing. And I would say, Theresa, that you are one of those people that's like very, very qualified for what you're doing. You know the Agency of Human Services inside and out. You worked there, you were in charge there. And I'm curious, before we sort of get into the policy, like, what is it like to go from like inside the machine to like what we're doing now?
Yeah. Well, I had, a few years step away from when I was actually there to sort of feel the transition a bit easier. One of the reasons that I wanted to be in the legislature was, frankly, because having been in the building and testifying before the Human Services Committee, the Appropriations Committee, and those are the 2 main ones that I testified before. And I thought, how cool it would be to work in this place and to try to be a person on the other side of the table to ask the questions and try to set good policy for the state and try to provide leadership for the state government to help Vermonters in ways that make their lives better. And so it's a real honor and responsibility, frankly. I take it really seriously, as I know that all of my colleagues do. And but it was mostly because of my experience in state government that I ended up wanting to be a legislator.
I really appreciate that. That's true for me too. And I find that it's a funny thing to explain when campaigning, but I think it makes the work, once we're doing it, that much richer.
Yeah.
Yeah.
Mm-hmm.
Olga, when you froze up, I'm sorry, I'm not sure exactly what it is that you were about to say.
A lot of times I don't know what I'm about to say either until the words come out of my mouth. It makes life interesting. So I was saying how impressed I am by the Human Services Committee, because to me, the depth and breadth of the bills that you take on just seem much more complex than some of the other committees work, not to diss any other committees. They all take on complex work, but this is literally human services. And I'm curious, what for you will be really potent for this upcoming legislative session that you really think will be front and center for you guys?
Mm-hmm. Well, you are right, Olga. I mean, we deal with everything from maternal and child health and pregnancy services all the way through end of life and supportive services for people to make decisions about how they want to die. And it's the whole life spectrum. It's really the social fabric of our state. And with that, we get to see both the good and the bad, honestly, the troubled and the joyous that can happen. And, in terms of what we're looking for at this session, one of the things that I am really dedicated to doing is to ensuring that each sort of major population area that our committee is responsible for gets their fair share of airtime in our committee. And sometimes, big bills like, I'm just going to throw out the child care bill, can take up, almost an entire session because it's complex. There's so many people that care about it. And then things that are just as important, but maybe don't have the strong advocacy that things like childcare have in the state right now, don't necessarily get their fair share of airtime at the legislature. And the issues are just as important. So one that comes to mind is we're going to be taking up a whole rewrite of the Adult Protective Services bill. And that is the bill that's the law that currently governs abuse, neglect, and exploitation of older Vermonters and Vermonters with disabilities. And that bill won't be something that has all of the hoopla that the child care bill has, but it is just as critical and important to Vermonters in the work that we're doing and in what people expect us to do. So it's trying to balance, not just hearing the loud voices, but hearing all voices.
Yeah. And like really bringing what I've seen your committee do in the past is like really bringing the voices of the folks who are on the front lines doing the work into the building really regularly. And I'm happy that with Zoom, that can be even easier for people. Can I ask you like a really niche question about protective services? I mean, Sure. It's not very niche, but I think when you first said it, I was thinking about sort of, recent cases that I've seen in the news with, older adults, I think living in the kingdom and like really just some like very clear abuse and neglect in a custodial situation. I've known quite a few members of my community down here in Windham County who were younger, like teens, 20s, disabled youth who got involved in the criminal justice system and really got like bopped back and forth between disability services and corrections. And everyone said, corrections said they don't know what they're doing. And so we are not an appropriate place. And the disability services folks said they're essentially too much trouble because they keep on getting involved with the law. And so we don't know what to do. And it's just like a wild thing. And I wonder if that's like, is that part of the purview of that? Or is that like a whole other issue to tackle that I shouldn't have brought up because you'll like do it next year?
It is a whole other issue.
Okay.
And we actually do have a law right now, Act 248, we call it. And
yeah,
that's a law that where the judicial system can determine that a person is likely to have committed that crime that they're charged with, but they are not competent to stand trial for that crime. And so they are adjudicated to the custody, in this case, of the commissioner of the Department of Disabilities, Aging and Independent Living. We are more accustomed to hearing about cases where people use that defense with a mental health disability, mental illness, and being committed to the custody of the commissioner of the Department of Mental Health. But we have a very similar law around folks with developmental and intellectual disabilities. And so if the court adjudicates that, and if there's, an agreement reached with the prosecutor and the defense and the judge, a person can be committed to the custody of the commissioner of Dale. In that case, there is no, they can't be sort of bopped back and forth. The folks that you're talking about are likely people who were considered to be competent to stand trial. And maybe then were sentenced, had some sort of sentence, and then, served that sentence, and now maybe are, sort of back at what they were doing before, which got them into trouble to begin with. So it's not the APS bill. It is a whole nother topic for another day.
Cool. Thank you. And you actually, I somehow never realized that like it's sort of that same set of statute that's like you're remanded to the commissioner of mental health or your commissioner of disabilities. That like totally makes sense to me now. Thank you. I appreciate that.
Well, I think that's a really great question, Emily. And Theresa, your response really highlighted how knitted so many parts of human services are to other parts of the state government system. And Emily and I have talked on the show before about how do we get bills and committees to work together, because quite often it requires pulling levers in different parts of state government. For you as at this point vice chair, how do you kind of pull multiple levels if something goes outside your committee? Does that make sense?
Oh yeah, no, I totally get it.
Good.
I totally get it. And that is one of the things about how difficult it was legislating from our, home offices, because you really do, in my case, jot across the hall to the healthcare committee and talk to the people in the healthcare committee and say, I got this issue is coming up. I think it might be of interest to you. We should work on it together, that kind of thing. And certainly, as returning legislators, I'm sure Emily has been doing this as well. I've been meeting with other, sort of kind of current vice chair type folks and trying to set out like what could be some of our more defined working relationships, relationships that benefit from having some structure around them. So I'm going to use the healthcare committee and human services. So at one point in time, they were one committee. It was, like in the Senate, it's Senate Health and Welfare. We used to have House Health and Welfare. Well, many years ago, they separated out healthcare and then human services. And but there's a lot of overlap. There's a lot of situations where the things that we do impact each other. And the opioid crisis is one that I'll just happen to mention. So, in meeting with key leadership of that committee, we've thought about how do we more formalize a structure where our two committees have, sort of like, I'm going to call it a SWAT team, but it's not really a SWAT team, but it's probably two from my committee and two from that committee. And they are really responsible, not just for, making sure that we are involving the other committee in policy decisions around opioids, but other things that cross over our committees, like I can use the health of the designated agency system as one. So in healthcare, they deal with mental health. In my committee, we deal with substance use and developmental disabilities. All of those services are provided by the designated agencies, and we have a real need for those agencies to be healthy organizations serving our communities. And so, we have worked really closely on doing the best that we could to ensure that. So, just reaching out to those other committees, developing relationships. So there's a lot about relationship building that is really important when you're legislating. It's critical. And then you reach out to committees that maybe don't have anything to do with you, or you don't think that they have anything to do with you, but then you find, oh, they do, like commerce, who would have thought, that was one of Emily's previous committees. And I'm like, Commerce Committee and childcare have had a lot to do with one another, and workforce, the amount of time spent on workforce in that committee. And that impacts everybody, that impacts all of the committees, frankly, across government. And,
Theresa, I love so much that you're doing that. Like, I just like that formal collaboration between committees. I know, in my few years, there's often been like one point person on each committee who's supposed to liaison with other committees, but having like a much more structured system for committees that are going to be like your regular go-tos, I think is really incredible. And I actually never go upstairs to where your committee room is really, but like the fact that you're across the hall from healthcare is really nice. I love that.
Yeah. I mean,
I wonder if someone actually did that purposely once, or if it's just like a really delightful coincidence.
I have no clue.
Yeah.
All I know is that Human Services has been in the committee room where it is for many, many years. So I don't know. I don't know if that was a conscious decision or not, but yeah. So I can't really stress enough the importance of relationships in trying to do good work. And it's not just relationships with people who you think are going to agree with you. It's relationships with people who probably don't agree with you. And I really feel this, and this is, I think, probably comes from my background, both in state government, but also as a school board chair for 12 years, that I feel like we make better decisions when we have different points of view around the table, and points of view that are close to the decision that you're needing to make. And that is always important to me.
Mm-hmm. Theresa, just curiosity question. Are there, how do I want to phrase this? You talk about committees that might be naturally aligned, like healthcare and human services, but in your work with human services, because it touches on so many other parts of state government, are there either committees or parts of state government that there's almost like the systems are clashing? Does that?
I can think of it, like it's sort of a long-standing clash, and that's between the Agency of Human Services and the Agency of Education. And even many years ago when I was at the Agency of Human Services and we were trying to work together with AOEs, particularly around transitioning youth with disabilities from education, which is an entitlement system, to an adult system that is not an entitlement system. It's an eligibility and resource availability system. So we tried to work closely together. And yet I'm just going to be honest, we found it very difficult. That the mindset, the philosophy is very different. And that has plagued us, frankly, in the pre-K world and the early childhood education world. And this is I wasn't there, so I guess I'd be the Monday morning quarterbacking on this. But when the pre-K bill left, they call it universal pre-K, and I'm just going to put out there, it's not universal, but they call it
so far from universal.
It's so far from universal that it's not even funny, but they call it UPK, universal pre-K, and it's not, but that's what the name of it is. And it involved a dual system with a public and a private pre-K. Well, the private part of it never got a hearing in Human Services Committee. The bill never came to Human Services, and if it had, we could have avoided some of the mistakes that have happened and some of the real issues in implementation that have happened. And it's just, different committees have a different mindset about things, and just, sometimes things happen and you don't realize something until it's too late, frankly. And that's kind of what happened in this case. So, we're going back. We have a major child care bill coming out, and, we're going to try to clean up some of that stuff that is causing quite a bit of angst in our communities.
And it's funny, Theresa, when I was at the Agency of Human Services, there was a broad perception that the problems between like the education system and the human services system were because of the personalities of the commissioners. And both of those commissioners are gone now, so I'm just going to like be able to say it. But like clearly not. Clearly, it's like they're like basic systemic issues and different understandings of the world, different ways of organizing, different ways of like very different systems of control, like down into the field, very different systems of funding, like, it is not just like a single personality. But I feel like, so because we're a tiny state, so many of those decisions get like either blamed on the personalities of, say, the chairs or the commissioners or whatever. And then so much when like really there are these like elemental things that transcend.
Yeah. It's different ways of seeing the world and different ways of seeing what your part in state government, what role that has in the world is just different. On a positive side of things, another one of the things that our committee deals with is toxins and toxic substances in the environment. And the Agency of Human Services, primarily with the health department, and the Agency of Natural Resources, that also has responsibility in this area, work very well together in terms of trying to do things like the PCB testing in schools and the lead water testing that we did a year or two ago. So those are things that cross over. And, there's been excellent collaboration between the public health sector and the natural resources agency in their environmental division. So that's an example of where things have worked really, really well.
Mm-hmm.
Thank you. We have just a couple minutes before we need to go to break on WVEW. What in this segment, what do we want to leave listeners with?
I wonder if we just want to do a teaser about the stack of policy things we might talk about after the break.
Well,
give us your list, Theresa.
I was just going to say, reach up supports for low income individuals, certainly childcare, opioid issues, and overdose prevention sites. Maybe that'll be enough to get people to come back and tune in.
Mm-hmm.
Yes.
Those are some favorites.
Representative Theresa Wood, Rep. Emily Kornheiser, and I will return in a moment from break, so don't touch your dial. Welcome back to the second half of the Montpelier Happy Hour here on WVEW 107.7 LP Brattleboro, your community radio station. If you're just joining us, I'm Olga Peters, and I'm speaking with Representative Emily Kornheiser and Representative Theresa Wood, and we're talking about some of the work the House Committee on Human Services is likely to tackle in the new legislative session. Hey, Emily, you going to remind listeners of something?
I am. The views and opinions expressed here on the Montpelier Happy Hour are those of the host and the guests, respectively. Not the station, nor their employers, friends, acquaintances, neighbors, puppies. Just us. Really took that one pretty far this time.
Well, I have to say, Theresa, I admire your willpower, because for listeners, before we went on air, Theresa was showing us all the baked goods she's made for the holidays, and they're all around her on her desk. So I just want to say, well done. with not just diving in. I don't know that I would have the same willpower.
Yeah, well, I have to tell you that the little rum bonbon thingies are looking like they have my name on it before we're done, or at least when we're done, I should say.
Instead of cocktails, we have rum balls this time.
I like that. I like that. That's perfect. That is our cocktail of the week, a rum ball.
Love it.
Mm-hmm.
So Theresa, before the break, we were talking about some of the things that the committee might be dealing with. I would love to start with Reach Up, if you don't mind. That's something that Emily and we spoke with, was it Representative Small?
Mm-hmm.
Emily, about Reach Up.
Yeah.
So I'd
that
love
would make sense.
I'd kind of love to hear what's next for Reach Up.
Okay, well, Representative Small was is currently a colleague of mine on House Human Services, and she is very passionate about making reforms to the Reach Up program. And I'm sure that she's probably we really made some dramatic reforms to the program structure last year with some pretty exciting work that kind of went under the radar, frankly. But it was really
well done, Theresa. Well done that went under the radar. That was some nationally revolutionary stuff that you all got through.
Yeah.
Mad props.
And I will say, because I like to give credit where credit is due. that a woman by the name of Erin Olikin, who works at the Department for Children and Families, specifically on Reach Up, she was she's a visionary when it comes to this kind of work, and she's really somebody to be celebrated in terms of the kinds of things that she has done to empower families and to think about strengths and to think about how we can help families without making them dependent. And she just is really good. So it was very helpful. The administration was somewhat collaborative on this. I mean, we might have gone a little bit further than they wanted, but in the end, it was really good policy work. So
no, and Erin's been like going to been part of national cohorts to look at like what like deeply evidence-based practices are for these things and like helping Vermont participate in that for a long time. So like she really like brought the right evidence to the table for you all.
Yeah, she really did. And it really, what we did is, for listeners, we really moved from a regulatory framework to a strengths-based framework that consists of, family planning and strength-based planning with a family, meeting them where they are right at this moment and helping them move forward. And that's not how the law was worded. The laws were very hard-handed and not really not strength-based at all. And they had little tweaks over the years here and there, but they really hadn't had an overhaul the way we did last year. So that was very positive. However, we still have quite a bit of work to do, and that's mostly now on what I would call the financial side of things. And so, we go through this calculation for Reach Up families who are, they're, I just want to put it out there. I mean, these are people who have probably the least resources in the state, people who come forward and they don't, a lot of them are single moms. It's not a place, you can't live off from Reach Up. I'm just putting that out there, so I'm trying
There's like no way in the whole world you can live off of Reach Up.
No. I'm just trying to dispel the myth that, is out there among people who say, oh, people are living off the state and well, you can't live off and Reach Up. I'm just putting that out there. I don't have my other computer open in front of me. Otherwise I would, tell you what the dollar amounts are. But
last I checked, it was $450 a month. And if you had rent paid for some other way, and then like some other hundreds of dollars a month to cover rent, that was in no way close to what market or even subsidized were. Like
no way close.
Yeah.
When I have folks in my community say that like the workforce shortage is because people are like living off of benefits, I'm like, do you know how impossible that is? Like it's just,
yeah. A famous quote from a Republican on the committee back when it was my first year on committee, and it was Representative Brian Keefe. He said, who would choose to live off from this? Nobody would choose to live off from the, I mean, it's insufficient. And that was back before we had, closing in on 10% inflation and, all the additional stresses on families from the pandemic and schools and, all of that. Anyway, so this year's focus, I know that there is a bill being submitted because I've seen a draft of it. But the focus that I wish to have is reducing something that we call the rateable reduction. So what that is that we determine, based upon all the information you submit, what you're eligible for. And, let's just say that's, $400 a month. And then to live within the budget, we have something called the rateable reduction. And so we take that $400 and we say, yeah, we know that's what you need, but we're going to reduce it by 50%. And so now what you're going to get is $200. And my goal is to I don't know if we can do it all in 1 year, but my goal is to transition out of the rateable reduction. And that would be a major step for the Reach Up program. that would impact a lot of people in a very positive way, and really, I think, help us to make major strides into moving children and families out of poverty.
And Theresa, maybe you said this and I didn't quite get it. I don't understand why something like that would even exist in a funding,
because
a support funding system.
because there is this thing called within resources available. You know, that's, we often see that in the Appropriations Act, or we see that in other bills, like in policy legislation, you'll see, you know, within resources available, or we'll see the term notwithstanding. I hate that word. I will never use that word outside of the legislature, and I don't like using it inside the legislature, but it means, okay, well, we just said all of this, but maybe you're not going to have to pay any attention to it. Yeah, it was an eye opener for me, frankly, the first time I had, you know, a session on it in our committee. I was like, what? You know, what do you do? What do we do? You know, that it just seemed like, so I could not understand the logic of it at all. And it only has to do with resources. And we need to, you know, frankly, I think we need to start living our values and, you know, putting our resources where they can make the most difference. And so anyways, that is going to be a thing in Reach Up. That is something that I am want to work on. I don't, you know, these are all things that, you know, haven't sort of passed the muster of, you know, moving by leadership yet. So hopefully the speaker isn't listening to our little show here.
If only she did, Theresa, that would be, I feel like I would like have it made by the end, you know, that's persuasion in the podcast.
So another thing that I just want to mention, because it's so critical to Vermonters who are experiencing so much pain around this with their families, and that's the opioid overdose issue that we have. And we passed a bill last year that the governor vetoed that would have, it wasn't creating anything. It was just asking the administration to research and come back with further information about overdose prevention sites. And to, you know, to look at things like liability, look at things like, you know, how could something like that operate in the state? And the governor vetoed that bill. And that was,
and that bill also included some like really important, like thinking about how maybe the hub and spoke model has changed over the last decade, right? Like it was a lot of just like, our system was actually one of the best in the country and it's not working anymore, so let's improve it. Like it was really like broad, deep, great bill that would have eventually saved lives.
Yeah. And I think that, you know, we had testimony from the Commissioner of Health saying, you know, why do we need this? We have the hub and spoke system. We have no waiting list. And, you know, we said, but record number of people are dying. So while we have this system, and it's, you know, it is lauded as one of the best in the country and all of that kind of stuff. And it's certainly a component of what we need. I'm nobody's saying to get rid of it. Okay. But there are a cohort of people who are not going to access that system. And we need, instead of expecting the people to come to us, meaning you know, a healthcare provider or a substance use provider, we need to meet them where they're at. And an overdose prevention site, in my estimation, is our best chance at meeting them where they're at. And I think we could have a partner in, you know, our largest city who could help us figure that out. But frankly, it's not needed just there. You know, it's needed in
Brattleboro is absolutely ready. Like this was a big topic in some of our pre-session meetings with both our town government, with our major mental health provider, and with our area homeless services agency. Like we are, and our hospital, like we are ready down here too. And we've done a lot of research to set it up. So
yeah. And so, you know, even more rural places like Lamoille County, you know, Representative Dan Noyes has been talking with folks at Jenna's Promise, which is a sort of a wraparound local place that was set up as a result by the parents of a young woman named Jenna after she died from overdose. And the things that we're trying to do with this is to impact the safety of the individuals, the safety of the community too. It will help our homeless situation. It will help law enforcement. They won't be needing to, be making as many calls. If we can, get a system in place that takes a look at, I don't know if in some places they've talked about mobile units, but in any event, we need to work on this. And I'm really committed to getting something across the finish line this year to I think we're going to go, in my estimation, I want to go further than investigating. I want us to set up, one or two overdose prevention sites in the state as a result of legislation that we passed this year is what I am really, that's my aim. That's my goal.
So happy to hear that, Theresa.
Mm-hmm.
And I think one other like unintended consequence or like consequence that maybe people don't think about in terms of where this would improve communities is our human services staff, like at, both at our mental health designated agencies, but at all of our service providers, our youth services agency, our school. We know that we have a huge workforce shortage there. We know that they're not, making as much as they deserve, but also I'm hearing more and more stories about just like the number of deaths that folks have witnessed in the last few months, in the last year, and just like the toll that takes on that agency's ability to grieve and process and deal with that trauma and like show back up at work.
Yeah.
And so people are leaving the field because they feel powerless in the face of
I think
like everything that's happening.
It's far reaching. I mean, it's not, it obviously doesn't just impact the individual, it impacts their family, it impacts the people that those folks interact with. It's a lot. And, I don't think the numbers are not going in the right direction. And so I really think the health commissioner will be hard pressed to say we're doing everything that we can and that's enough. I don't think that he will be able to say that this year. And it's certainly not what we want to hear, frankly. I'm just putting that out there. And I will tell you that 3 years ago, you wouldn't be hearing me say this. I'm kind of what you call, one of the more moderate Democrats in our caucus, and it is not something that I was like, what are you talking about? And I can tell you that we need to do more to prevent the harm that these substances are causing in our communities. And I think that this has far-reaching implications to help people and to reduce the harm that is happening in our communities. I was at an EMT sort of mini summit that Representative Catherine Sims put together, and it was one of the top issues that they brought up is the responding to overdose calls, and that the trauma it's causing for our first responders, to bring people back from the brinks of death, and only to do it over and over again. And it's really, really stressful and difficult on them. And it's one of the things that they don't get paid to do. It's one of the things that causes them stress, and they're afraid that the next time they go, it's going to be too late. It's so it can improve the stress on our first responders in those situations, and I think we could get support from that group of individuals as well. So I think it's time, and we have some other places in the United States. In New York, there's a lawsuit in Pennsylvania that we're waiting with bated breath to see. Looks like it's could fall in the direction that we need it to. Of course, in Canada, they do have some of these sites, and it's time for us to take a look at that. Vermont's population, we talk about being a small state, and sometimes in a small state you can do things that you can't necessarily do in a larger state. And I think this is kind of one of those things that we really could do, and we could do it well, and we could save lives with it.
Mm-hmm.
I feel very heartened to hear you say that, Theresa. Thank you.
Yeah. Well, because I think the other thing, Theresa, you touched on about being a small state is a lot more things are personal.
Mm-hmm.
Things don't happen to someone else. They happen to your neighbor or your cousin or your sibling or
your friend's friend, or it's I mean, I think we all know somebody who has been touched by the substance use issues in the state, and or in other parts of the country. You might have family or friends living in other parts of the country impacted. But anyway, so that is really one of the things that are on the top of my list this year.
And then Theresa and I talked pretty endlessly about family medical leave insurance and childcare and sort of those twinned issues, and what it means to make sure that Vermonters have the opportunity to care for each other, essentially. Like it's not so complicated. I feel like that's a whole show though, that maybe we should say for a week or two once the session starts, because
it does. But I have just a little anecdote, just a little short story from. So last night, Let's Grow Kids is going around the state, and they have these forums, and I don't even know what last night's one was called, but they're doing, they're doing them all over the place. And so I was there there were 4 representatives there, actually. Representative Tom Stevens and I, we're both from Waterbury, Representative Dan Noyes from Wolcott, and then a new representative, incoming representative from Stowe, Jed Lipsky. And so the focus was on childcare, but we had an opportunity to say, okay, if you're dreaming, what are you dreaming about? And so I was dreaming about a state where, just as Emily said, where we're able to take care of ourselves and we don't have to forfeit our jobs to do that. And so I brought up paid family and medical leave, and I said, you're going to hear people, you're hearing them already saying, we can't afford to do both paid family medical leave and childcare. And I'm here to tell you that we can't afford not to do both. And so I went through all the reasons, and I did my I guess it was heartfelt and impassioned enough. And Jed Lipsky, who is an independent, quote unquote,
he sways R, we'll say.
He sways R, yeah.
There's a lot of independents in Vermont.
Yeah, I ran as an independent the first time. He looked over and he said, I came in here, and he said, Dan and I actually had this conversation on the way down here from Stowe. We're like, I don't think we can do both. And it's like, and I am solidly behind childcare. I don't think we can do family leave. And he looked over at me and he said, I am on your train now. We're doing, we need to do both. I'm like, okay, good. I'm glad to hear it. So I think, I've heard recently, and I hadn't really thought about it, in this way, but again, last night this came up, thinking from a place of scarcity, and always thinking about sort of, worst case scenarios and why we can't do something. And instead of sort of like leading with our values and saying, these are the things that we need to do to support families. You talk about workforce in Vermont, I represent 2 school districts. Each of those school districts has seen a reduction of over 1,000 students each in the last 10 years. Okay. That's because people, one, can't afford to have children if they want to have children. They can't afford more than one. If they, I've talked to families who say, well, I really would like to have another one, but I don't want there to be 5 or 6 years in between them, and I can't afford to have 2 in childcare at the same time. So if we have no other state, okay, there are other states who have paid family and medical leave. There are other states who have a childcare assistance. No state has the combination that we are really talking about here. No other state has that. And Vermont is going to be the state that leads the way, and is a state where families are going to want to move to in order to raise their children and have their families and stay here.
And care
and
for their aging parents and like
That's right.
care for each other, right? Like we can.
Yeah, it's not just
We can
about
do
young
that.
families, right? The paid family medical leave is about people across the age spectrum, caring for a spouse or a family member who has cancer, or, feeling like you can take off, work because you're exhausted for taking care of a family member, or you have that illness yourself and you're not covered by any other sick leave or anything else. So anyway, yes, you're right, Emily, that could be, that's definitely a whole other sort of complete show.
And I think that's what's, I just think it's extraordinary to really get our heads around the fact that like it's practically impossible for so many people to care for themselves and their neighbors right now with the way the economy is structured, and that like we could make it possible if we just like do the work to get it done, right? Like just
it's so funny because there was a business owner in the meeting last night, and he's a more forward-thinking liberal business owner. I will grant you that. He owns a place in Middlesex there where Camp Mead is, where Red Hen Bakery is and stuff. And so he said, there's money in Vermont. We just need to tap into it. And I couldn't agree with him more about that. There is a lot of money in Vermont. I think that we need to do the things that we can do in order to support families. Let's be the best state in the country to do that. I don't have any problem.
I think we're running out of time, and
we are,
I just
yes.
want to like add another sort of thread for next time, Theresa, and maybe we can do this regularly because this is like my favorite stuff to talk about, and I know it's some of your favorite stuff to talk about. But I know you've been a huge, powerful champion on the issue of Medicaid reimbursement rates. And why, like what that's needed for quality of care and for providers, and just like you have like stuck to your guns about that in a way that I super respect. And I think we did some like really good work with the designated agencies in sort of that universe this last year. But I've just been so like thinking so much about how low wages are in my county, at least, and how difficult that makes life for people, right? And how so many of those wages are like directly related to state grants and contracts related to human services, right? Like the underfunding of our human services contracts through Medicaid reimbursements and through other kinds of grants and contracts is why wages are low in Windham County for the most part. Like it's really, there's also the tourist economy, but it's really like,
I was going to add,
are like the big levers around where people work around here. And how much us doing something about this like really core issue around like that the state has so much control over would like not just improve the provision of human services, but would like really transform the quality of life of the people who are working in those systems too. And their neighbors and the shops that they buy stuff from, and like all of it, just like transform our economy. So let's talk about that next time if we can.
All right.
Well, Representative Theresa Wood, thank you for joining us from Waterbury today. If people want to learn more about the work of the Human Services Committee, where on the legislative website can they find that?
If you go right to the legislative website, and you'll see a little tab that says committees. And, if you just hit that, you can just scroll down to Human Services. That brings you right to the committee webpage, or any other committee that you're interested in is there as well. So, and our agendas are posted there. We will be live streaming this year, as we have been for the last 2 years. And so we are more accessible than ever to Vermonters who want to listen in and see what we're doing and participate in that way. And so, that's where you can find our work.
Thank you. Emily, if people want to find out more about you, what do they do?
Folks can go to emilykornheiser.org to go to my website and find all my contact information. Or you can go to the legislative website and do the same thing that Theresa described, but go looking for the Ways and Means Committee. And I'm realizing that I should put a link to the Ways and Means legislative website on my own Emily Kornheiser website. So I will attempt to do that sometime in the next 3 months. Set
Thank
realistic
you.
deadlines for myself here, everyone. Thank you, Olga. Thank you, Theresa. I'm so glad we could do this today.
Yes.
Great.
And thank you everyone for tuning in to WVEW 107.7 LP Brattleboro, your community radio station. We'll see you next week.